Testing hip external rotation, also known as hip lateral rotation. Patient will be in a seated position. We are going to be testing this leg or this hip. So to do that, this foot needs to go inward. So to do that, we need this leg, this foot, to go outward to make sure that we have full range of motion possible for this leg. So what you will have your patient do is perform full external rotation to the best of their ability. So Rachel, I want you to bring this foot as close to that foot as you can. And now come back. Because she's able to do that, I will classify that as a 3. Now, Rachel, I want you to come at about halfway. I will stabilize here, and I will add resistance here, just proximal to the ankle. So go ahead and resist me, Rachel. 3, 2, 1. Come back down. Because she's able to resist me, I will classify that as a 4 or a 5. Testing hip external rotation, also known as lateral rotation, gravity eliminated position. We will be testing the left leg. First thing I will have my patient do is point her toes away from her into hip external rotation. Okay, now bring them back. Because there is movement here, I will classify that as a 2. If there is no movement at the joint, then there are 6 muscles at the hip that externally rotate it, such as the obturator externus and the piriformis. Now to palpate these muscles, you're looking at the lateral side of the hip and also deep in the middle of the buttocks. And this is already a sensitive area for most patients, so you want to be very cautious about, how you palpate these muscles and and who you're palpating on. But since these muscles are difficult to palpate, you can simply measure a 1 or a 0 depending on how much the foot moves. If you see it move at all, slightly, you can classify that as 1. And if you see that there's simply no movement, you can classify that as a 0.